Hello, everyone. My name is Lene Cad, and I'm here with Tondalea Warren and Dr. Bruce Rosenzweig, and we are going to be giving an interview on interstitial cystitis. The first question I'm going to start off with is, what are some epidemiological statistics about interstitial cystitis?
Well, interstitial cystitis is a poorly understood disorder, and so a lot of statistics are extrapolated because there are some doctors that don't believe it exists. There are some doctors that misdiagnose this as a patient having a urinary tract infection. There are other patients that are diagnosed with endometriosis, which is a disorder where the lining of the womb gets out of the womb instead of being shed every month and gets into the abdomen and sets up pain and adhesions. But the best statistics that are out there is probably 1 in 10 women that have lower urinary tract symptoms will have interstitial cystitis as the cause of that. And what I mean by lower urinary tract symptoms is that they have to go to the bathroom frequently and urgently. Frequently meaning more than 6 to 8 times during the waking day. Urgently meaning that they have an uncomfortable desire to void. Or getting up at night to pee more than once or twice at night. And that's from waking you up from a sound sleep, not just because you got up to do other things, but were woken from a deep sleep. And then there has to be pain associated with it. Pain could be back pain, pelvic pain, pain when the bladder fills, pain when the bladder empties, just a constant pressure after the bladder's empty. So those are the hallmarks: going to the bathroom frequently and urgently and having pain associated with it.
Okay. I'm going to start off with the next question. How is interstitial cystitis diagnosed?
Well, again, it's a diagnosis by exclusion for most practitioners. Since this is something that I deal with every day, when a patient comes to my office and they have the classic symptoms, I can pick up the diagnosis very easily. But the hallmark symptoms of pain, frequency, and urgency helps lead to the diagnosis. But what doctors have to do is understand that if a woman comes in and says, I think I have a urinary tract infection, and she gets treatment for that urinary tract infection, and it comes back again in a relatively short period of time, that's not a urinary tract infection. More likely, that's interstitial cystitis.
Okay. Next question. What signs and symptoms? What are the signs and symptoms of interstitial cystitis?
The symptoms are, as we talked about, frequency, urgency, and pain. And that pain can be just a dull, achy pain, a sharp stabbing pain, and again, a pain when you pee, pain when your bladder's filling, or just a back pain, along with the frequent urination and the urgent urination. Now, the signs are, when you look at the urine, there could be some blood in the urine. There could be some bacteria in the urine, and there could be what we call white blood cells. So when a patient comes to an urgent care office or to our office, we automatically check the urine to see if there are any of those signs of either a urinary tract infection or interstitial cystitis. Urinary tract infection is the big thing that we want to keep in our differential diagnosis. And then we might do other things like look inside the bladder or do a test of how well the bladder is functioning, because that gives us an idea about how we're going to treat it.
Okay. Next question. What is the cause of interstitial cystitis?
Well, the cause is not known, but the theory is that the bladder has a protective lining, and that protective lining keeps all the irritants inside of urine. And I tell my patients that the kidneys is like a toxic waste filtration plant, and the bladder is the toxic waste storage area. So all the things in urine can be very, very irritating, and without this protective lining, all the irritants inside of urine can get into the bladder and set up the symptoms that we talked about before. But that is just a theory. There's no way we can measure the protective lining of the bladder, and there's no way that we can see if the protective lining has grown back again with treatment.
Okay. Now, next question. What is the treatment for IC?
There are a number of different things that we can use. Most commonly, we look at the things that can irritate the bladder, and those are things that we eat and drink. If any of us went to a Mexican restaurant and ate the hottest chili peppers, we would have irritation in our bladder and we would have irritation in our colon. So that is an example of the highest level of things that you can eat that are irritating. On the other end of that is someone that just drinks a glass of milk, which shouldn't be irritating to the bladder, but has all the symptoms of an irritated bladder. Most of us are somewhere in between, where if you have something that is more irritating, you're going to be generating symptoms. If you have something less irritating, you are not going to have symptoms. Someone with this disorder, they get shifted down where things that should be less irritating for the bladder actually become more irritating. So the important first step in treatment is to identify things that are irritating in the foods and beverages that you're drinking, such as coffee, NutraSweet, acidic fruits and beverages, very spicy fruits and beverages, alcohol, in order to avoid them, in order to make the bladder less irritable. Then there are certain medications you can take by mouth, and that's based on all the testing that we do to decide what is the best medication to put the patient on. There's also medicine we can put directly into the bladder, and that works very, very nicely and very, very quickly. And so there are a variety of different things that we can use based upon the patient's symptoms and what we find on diagnostic testing.
Okay. Next question. Do you think using a power juicer would be an excellent source of managing IC?
Well, that's a very good question. It all depends on what kind of juice you're putting in the power
Fruits,
juicer.
vegetables.
Okay. Yeah, there are certain fruits and vegetables that are irritating, and I provided you with a list of the various fruits and beverages that can be irritating. So, but just because something's on the list, that doesn't mean it's irritating to the individual patient. And what we tell patients is that avoid a certain food group.